Thank you, Chair, and thank you both for the answers you've given in this session and for answers you give at other sessions for MPs. I just want to ask a few questions around public information, around the government strategies in the delay phase. How will you be communicating to the public what is expected of them?
I think that it looks as if the delay phase is the bit that's least well understood by the public. So I think it is clear that we need to explain both why we need it and then what is involved. So I think, so the question you ask is obviously critical on this. At this point in the early stage of delay, the actions are primarily ones of case finding, isolating cases that come from high risk areas. And this is to try and reduce the probability of seeding into the community and therefore slow down the initiation of an epidemic, and then trying to pick up cases early and isolate them in hospital environments so we minimise the chance of transmission within hospital. Once we get to the point that societal action is needed, and this will not be immediately, to be clear, this is something which we intend to say what we intend to do and recommend based on the science, absolutely based on the science, and then when it seems the appropriate time to do it, that will be communicated clearly, including through Parliament. I think it's an important, talking through Parliament is an important part of this.
Okay, and so through Parliament would be crucial, but I mean, should we be signposting the public to other sources of information? I remember you talking about the website, which is updated on a daily basis. What about other sources of information too?
We're trying to do two things. Three things actually. The first of which is to centralise our own information in one place so that people don't have to find it scattered across the system. Secondly, to work with the social media companies and others to make sure that accurate information comes to the fore, rather than
really cool.
Quite a large amount of noise in the system, which can otherwise confuse people, not through any fault of their own. And the third is taking out paid-for advertising, which is aimed at making sure the public know where to go for information that is accurate, and giving the key messages in a simplified form, and then signposting so that people can then access the more detailed information. So, but there will be a full communication strategy around this, because this is obviously critical.
Okay, that's very interesting about what you said about social media companies. How confident are you that they will be responsible in this regard?
I'll give you two answers, but this is as someone who I would not consider myself a social media expert. But my Secretary of State, Matt Hancock, who knows a lot more about this than I do, I sat in with him phoning up representatives of the major social media companies, and they were really very keen to help. And my experience, having tested out various strings of words searching on Google and other search things, is it does seem to me that actually generally good information tends to come quite near the top now, and that wouldn't necessarily happen randomly. So I do think that they are doing their best to help with this, but obviously any assistance on these kind of things will be gratefully received.
Okay, that's reassuring. An earlier response, you talked about publishing, perhaps with a 24-hour delay, but publishing geographical dashboards and maps and information. When do you feel this might happen?
Well, I think this is very much a question operationally for PHE. In a sense, the rate limiting step is we want to be absolutely sure that information that is put out is accurate. And my own view is I would rather have slightly delayed information that we're completely confident of than jumping ahead of ourselves in the wish to actually be timely and then ending up with information that we subsequently have to modify, not completely change. But that is something I wouldn't want to commit PHE. It's very much for them. Their intention, though, is to do this quite soon. So I'm expecting this to be within a couple of weeks kind of time, hopefully earlier than that.
Okay, and just finally, just one question I just want to get on the record and just to be clear. What would your advice be to members of the public around taking any sort of general precautions at this stage, such as stocking up on food and drugs?
There is no need at this stage to be stocking up on anything. Remember, this is going to be, to go back to the point the Secretary of State has made in the House multiple times, a marathon, not a sprint. And this is going to be a long period. There's going to be a lead time before the actual serious takeoff of this comes, which we'll be able to indicate. And obviously we're working with all the supply chains in our case of our own department, looking specifically at health products. So there is nothing in the current environment that would rationally lead someone to want to go out and stock up on stuff.
Okay.